Customers are no longer looking for us to be very transactional in nature. Whereas the past, the vendor that offered them the best price may be the one that they go with. Today, they're looking for someone that understands their strategic imperatives, where they're trying to go as an organization, and can collaborate with them to be able to achieve those goals. With TrueVue Therapy Management, we're doing exactly that, taking CRT and OST as critical pillars and making sure that we can use those to bring those customers to where they want to be in the future.
TrueVue Therapy Management will be an enhancement to our acute portfolio by reaching beyond products. So going out of the normal CRT products and into a special collaboration and consultancy with the customer, TrueVue will enable us to get even closer to identify customer needs in a whole different way and will broaden, in a sense, the contact and collaboration that we have with our customers. TrueVue Therapy Management is, as we see it, creating a great value by the customer sides and for the customers. First of all, by actually knowing, having data insights and data points to know how the therapies are running, to know how their therapies are performing, to know whether they meet their internal goals at the department as well.
TrueVue Management for me is the way to have almost real-life data provided to you in a report, so I can adjust how that we are actually performing on the Prismax machines. Is there anything the nurses need to be more careful about? Is there anything we need to teach them? Is there anything we need to adjust for us to deliver a better treatment to the patient?
We do this for the patients, right? We also do this for economy, but we do this for the patients. And I think TrueVue is a great helpful tool in improving patient care.
The creation of value for the customer is really about taking the data that we collect and not only looking at one particular treatment, but looking at the total number of treatments that they're doing at the clinic and take and analyze that data and build some insights around it.
I see TrueVue in the ICU improving the quality of the treatment that we are giving our patients from a machine's perspective. And I do see that we can understand the treatment that we are giving and see if the quality of that treatment is actually good, or is there anything that we could improve on.
Our main experience with the pilot project for TrueVue was really that we need to start early with our processes. We need to engage early with the hospital IT department, the data privacy people at the hospital. And we need to remember that this is really a cross-functional experience. Our advice to centers starting up the TrueVue project is really to engage within their own organization, to make sure that they cooperate with their IT infrastructure people and the data privacy teams. It's a key thing in order to get prioritization to close the discussions on data privacy agreements.
TrueVue collects data on the CRT machine. The smart setup that Baxter has come up with is that the data goes into sort of a central computer system, so Baxter can support us as clinicians, because we don't all have time to sit and look into all these graphs and numbers and figures. So we've had a real great pleasure of having some guidance from the team of Baxter. Sometimes we are advised about problems we didn't really know occurred, so Baxter was coming back to us. There's actually a problem in your unit here. You use too much filters or your recycling time is very little or very long. We weren't aware that we had a problem. Any technology should be about improving patient care. If it's also helpful in improving efficiency and cost to the unit, and also how we use the staff in the most efficient way, I think there's a huge potential in a system like this that in an ongoing process is capable of direct us through to a better patient care, basically.